Hi, everyone, and welcome back to another episode of From Print to Pod. Today, we have Dr. Athena Hall with us to discuss her interview feature called Reimagining Healthcare, Athena Hall's community-driven mission. Dr. Hall, welcome. Please tell us a little bit about yourself.
Yeah, thank you. I am a pediatrician. I live in Seattle, Washington, and I have always had a curiosity and a drive towards global health work, and it's actually why I went into medical school. I uh, did my first, had my first experience right before I went to medical school, where I volunteered in Tanzania. And that really solidified my path for me that I wanted to come back when I had the knowledge and skills to be able to give people in these low resource areas the chance to have healthy, thriving lives. I wanted to be a part of shifting how we do healthcare in these areas. And I did a global health fellowship right after residency in Rwanda and then in the Four Corners on a Navajo reservation. And during that time, I had a lot of internal conflict around how we were pushing a one size fits all healthcare model on these communities. And I saw the effect of that and the power dynamics that were happening. I felt that we could do a lot more and be a lot more creative to help people in the region to have the chance to live the lives that they wanted to live and to be healthy and to have their own culture and beliefs a part of their healthcare system. So when I came back to the States, I realized we were doing the same thing here. We weren't really asking the community what they wanted. We were pushing a one size fits all healthcare model on everyone here. And it was costing people a lot. People are having to make huge sacrifices to be able to afford healthcare. And many people in this country go bankrupt in order to pay for their healthcare bills. So I created Zena Health Network to bring people in the community and people in healthcare together so that we can reimagine what it looks like. And I think that takes people from inside and outside of the healthcare system. We need to hear all of our voices and really include our communities in this redesign.
Thank you for that. It sounds like you have actually answered the first question that I was going to ask, which is what your why was in terms of building Zena Health Network. Can you tell us, is that an acronym? And if it's an acronym, what it stands for?
Well, it's actually, I was working on trying to figure out the name for the network, and I met a woman named Zena, and it just the light bulb went off as soon as I heard her name. She had a different spelling, and so I spelled it ZNA. Uh, it's represents the future of our health, the future DNA. So next generation, I want us to be building a legacy healthcare system that we're proud to pass on to future generations.
Thank you for that. Now, you've spoken about shifting healthcare towards a community-centered model. What does whole health mean to you, and how does Zena support that vision?
Yeah, whole health is looking at not just the physical health of us, which is what our healthcare system currently does, but also the emotional, the mental, as well as the spiritual side of everyone. We are complex beings, and there's a lot more to our health than what we're currently addressing. There are some healthcare systems. There's one in Alaska that has a more integrated model where they really invest a lot in mental health as well as emotional health of people there. And they have traditional healers integrated within the system that are part of the healthcare team. So if people want spiritual support, it's readily available within the healthcare system. So I think having that investment in all sides of people's health is really important.
Now, you mentioned feeling isolated and burnt out in the traditional system. How does Zena combat that kind of disconnection for today's healthcare workers?
So Zena is a space for us all to network and work together across these silos within the healthcare system as well as outside of the healthcare system. We can be working with people in the food industry. We can work with people in non-traditional health pathways, as well as in school systems, and work with advocacy and policymakers to work together so that we can support our communities. So, yeah, Zena is it's a huge part of what it is.
And what were some of the biggest mindset shifts that you had to make when transitioning from physician to entrepreneur?
Yes, I grew up pretty hyper independent. It was one of my, I guess, what I thought was my strength was how independent I was and how hardworking. Um, I had, sort of the lone wolf syndrome of I can do it all on my own. I've got this. And it got me so far, and then until it didn't. And as an entrepreneur, you really can't go very far with that mentality. So over the last few years, have been shifting into really more of a team mentality, seeing what my strengths are, seeing what I need on my team, and like who has other skills that they can offer. So we really have to do this together. No one can do it on their own.
More along that line, you touched on the challenge of funding in your interview feature and being your own investor. What advice would you give to other physicians bootstrapping their own ventures?
That's a great question. I, yeah, I would say really have like that planned out a bit better than I did of knowing how much you're willing to put in if you are putting in your own money. And I went a little too far because I was just very passionate about what I was doing, and yeah, just really asking for help early on in the process before you get too far into it.
Thank you so much for sharing that vulnerability with us. We can all learn from you, even as you regroup and get stronger. Uh, Zena brings together healthcare professionals and community members. How do you ensure those two voices remain equally valued in shaping solutions?
Yeah, I think creating a culture within Xena is really key. So having that culture that we all of our voices are valued. We all have unique perspectives and experiences. And I think that culture will ensure that people step forward and speak about their ideas, as well as people making space for other perspectives and ideas within the network.
Thank you. How do you see Zena playing a role in improving health equity in underrepresented or underserved communities?
Yeah, so I think a big part of eliminating health disparities and addressing these sort of issues within our healthcare system is listening to the community, asking what do you need, and following through with addressing those needs. And a lot of the needs seem really, outside of our um, healthcare system realm, but that's where we're reimagining things. And many people come into the ER because they've had, root issues of like not having housing, not having security and stability, having chronic stress, facing racism on a daily basis. All of these things um, can end up in heart disease and high blood pressure and all of these long-term effects. And so, if we're addressing these needs early on and really listening deeply to our communities, I think that's where Zena is going to improve the health disparities.
Before we move on to the next question, quick update on what's your specialty again?
I'm a pediatrician. I
Right.
work in
Perfect.
hospitals and urgent care.
Okay, wonderful. That's good to know as a background to this. So, if you could wave a magic wand and change one thing about how medical institutions operate today, what would it be, and how close do you think we actually are to that reality?
Hmm. I think yeah, one thing, if I waved a magic wand, I don't remember exactly what I put in my interview because there are so many things that I would like to see changed. But one thing coming to my mind right now is collaboration. So having everyone collaborating within our institutions would make a huge impact on the health of our patients and just on sharing information and sharing resources. I think that would be pretty major.
Wonderful. And as a last question before we part ways, what excites you most about the future of healthcare entrepreneurship? And what role do you hope that Zena will play in that healthcare arena in the next 5 years?
Yeah, I'm most excited about just how different healthcare can look. It really excites me thinking about just really getting off of our elitism in healthcare and getting down into the ground with people in our community and listening to them and being equal partners. That's super exciting to me in healthcare, and that's what I see Zena doing moving forward is having that deep listening, having those equal partnerships, and just really caring for our communities.
I thought that would be the last question, but I actually have another one that I came up with is where do you host your community? Where do people go to
Yeah.
actually join the community?
So the community is on Mighty Networks.
Gotcha.
Yeah. And if you go to my website, there's a button that says join the movement, and that's where you can hop into the community.
Fantastic. I will interject and just add in that SoMeDocs has a communities directory. So if you, the listener, check out doctorsonsocialmedia.com/communities, you can see the different communities that healthcare experts are building. And we're very excited to host doctors like Dr. Athena Hall on our show, so you can properly be introduced to them and meet them and connect with them. So, Dr. Hall, before we close this episode up, do you want to leave with any parting words?
Yeah, I would love to see any of you all in the network and anyone that you know who is passionate about shifting the healthcare system. We need to hear your voices and would love to have you in the network. So,
Thank you so much for being here.
yeah, thank you so much.